AOC is going to make this greedy healthcare CEO, David Joyner of CVS Health, absolutely squirm while exposing the con job that he and his fellow healthcare CEOs have pulled on all of us. Just watch.
Mr. Joyner, you are the CEO of CVS Health, correct? CVS Health owns Aetna, the health insurance company, correct?
Correct.
And CVS, which owns Aetna, also owns Oak Street Health Medical Clinics, correct?
Yes, it does.
CVS Health also owns CVS Caremark, the pharmacy benefit manager, which helps negotiate some of these rebates and prescription prices, correct?
That's correct.
CVS Caremark helps determine the prices that patients pay for a third of all prescriptions in the U.S. In fact, I was following one of CVS's investor calls where they really laid out quite clearly what this means if you are a patient. This is what's known as a captive strategy. And CVS, in the investor call, used the example themselves of a patient known as Kate. Kate has an Aetna health insurance plan right here, and which is owned by CVS Health. She then goes to a CVS pharmacy. She's connected to an Oak Street Health medical clinic. She sees a doctor at Oak Street Health who prescribes her medication. And then she goes to fill that prescription at a CVS pharmacy. So the price Kate pays for that medication is dictated by Aetna, CVS Caremark, and they also own the drug manufacturer Cordavis. Mr. Joyner, this is quite a bit of market concentration. Wouldn't you agree?
No, I wouldn't agree that it's market concentration. I would suggest it's a model that works really well for the consumer.
Yeah, I think it works very well for CVS. I think, in fact, you all said on the call that you all call it a fully engaged member. It's great marketing there. Fully engaged member unlocks sizable value for payers and CVS Health. So the health insurance gets a cut, the pharmacy benefit manager gets a cut, the drug manufacturer gets a cut, and the patient gets screwed. I think the Federal Trade Commission has also found that healthcare conglomerates like CVS Health charge more for medications filled at their pharmacies. We're talking about 1,000% markups on medications for cancer and HIV. And, I think this is actually an interesting point of common ground that I may have with some of our Republican colleagues here in this hearing. Because whether you're a blue-blooded capitalist or a card-carrying democratic socialist, I think corporate monopolies are a problem. And this vertical integration is destroying people's ability to access care. I don't think we're seeing this across the board. And if they can self-deal, I saw something that was interesting from the opening statement of Mr. Hemsley from United Health talking about how much United spends, 85% on care, Mr. Hemsley? Approaching 90%. But the ACA forces you all to spend a decent amount of that on subsidies on care. But when you own the care, when the insurer owns the pharmacy, owns the PBM, owns the drug manufacturer, you also own the healthcare cost. You own a big chunk of the healthcare cost. And so, 100 years ago, we had this type of market concentration in our banks. And we did something about it when it crashed the economy. And we passed the Glass-Steagall Act. We should be considering that in our healthcare system. And if we believe in competition, I think we should put our votes and our legislation in alignment with that and consider breaking up this industry in order to allow the competition that prevents this kind of vertical integration and abuse of power.
AOC's breakdown is so effective in showing the parasitic nature of private healthcare because she does it in a digestible way, right? Where it's easy to track who is making the most off this process, off of this system when it comes to private healthcare, all the way down to the pharmacy, right? And the drug manufacturer, prescriptions, and so on and so forth. Other corporations, use the same business model, and they profit off of each and every step of the healthcare process, from like finding care all the way to prescription. So again, it's not benefiting the consumer. It's benefiting them and their pockets. CVS's business practices aren't a bug in the system or even a legal loophole, but exactly what our economic system encourages to happen. Because all that matters to Joyner and these other CEOs is to continuously increase shareholder value by any means necessary. So in the process, you're going to penalize the customer, or you're going to screw them over. And that shouldn't be happening. There's a world where people can still make money while also not making people pay a fortune to stay healthy. To stay healthy, you have to pay what? That shouldn't be how we live, but that's the system that we live in, right? Our economic system is a capitalistic one. And when that's the structure, you better believe people are so greedy that they don't care who they hurt in the process, as long as they and their shareholders get what they want, which is more cheddar.
With H.R. 1, the so-called One Big Beautiful Bill, we know that that President Trump and the Republicans that voted for this bill will make it much harder for our lowest income members of America to be able to retain their Medicaid coverage. So between the two, we estimate over 20 million Americans will lose coverage, essentially undoing every single gain we have made over the last 15 years. Unfortunately, between H.R. 1 and the unwinding of these enhanced premium tax credits, it disproportionately impacts do-gooder states like New York, who have expanded their Medicaid programs. We know medical debt and higher levels of morbidity and mortality have occurred in the states, mostly the southern states, that have refused to expand Medicaid.
Where the MAGA base is.
Correct. It's really sad.
So they're going to be most affected.
They will be most impacted.
But also,
but New York will especially be impacted because, like the good do-gooder states stepped up, expanded Medicaid. With the cuts to Medicaid, it will really impact those folks already. And basically, it dumbs down the rest of the country to the southern swath, where they have disproportionate levels of medical debt, higher levels of morbidity, higher levels of mortality, because they haven't expanded coverage. We know coverage counts. If you gut the Affordable Care Act by not funding these tax credits, and on top of H.R. 1, which is really trying to undermine Medicaid, access to Medicaid, that's like a double whammy that really will have profound impact against low-income people, people of color, and people who are sick. People with disabilities, people who have a healthcare condition like cancer or something that's completely out of their control. That's who is impacted the most by not having coverage.
A single-payer Medicare for all system would eliminate the profit motive behind the basic human right of access to quality health care. And it would be a massive net positive for the country in the long run. I don't understand. Well, I do understand, because we have a lot of evil people, a lot of terrible individuals who have no empathy, who have no compassion for people who are in a lower tax bracket, right, than they are, where they're not at the top of the food chain, they're not in the 1%, or they're not wealthy, and so they'll do anything to screw them over. And it's, in our country, it's seen as a privilege, not a right. Healthcare is a privilege. It's tied to your job. What? My ability to get quality access to healthcare is tied to my employer? You know how backwards that sounds? No, everybody should be entitled to quality healthcare. That's it. No debate, in my opinion. That's where I stand. I don't care if you are a bad person or, great person. Everybody should be entitled to high quality healthcare that is going to improve their lives. It shouldn't be a privilege. It should be a right. For Rebel HQ, I'm Chris Williamson. We'll see you next time.